All right, and we are starting on Unit 8 in clinical psychology. And here we're going to be looking at all the psychological disorders out there, as well as treatment for these disorders. All right, we're going to jump right in. We're going to start with Introduction to Psychological Disorders. And we're going to start with our first subtopic, which is basically how do we define psychological disorders? Again, a reminder, please make sure that you're writing everything, that you're pausing, you're jotting down little notes as we go. Okay, so we can have a nice little discussion in class. All right, so we're going to start with the first word, really, here, keyword, which is psychopathology. And that basically just means it's a scientific study of mental disorders and the different types of maladaptive behaviors. And you'll see that a lot. So make sure to get that word maladaptive behaviors, as well as how it's associated with various disorders. Okay, so this is just basically the study of mental disorders. And you're going to see it might be called mental illness, mental disorder, psychological disorders, and they all basically mean the same thing. Okay. Now, another thing you need to write down there is psychiatric disorders. Okay. So it's a little bit different. Psychiatric disorder has to do with being aligned with a medical definition and a clinical definition. Okay. And this is treated by a psychiatrist. Okay. And that is why they're going to prescribe the medication. Okay, so just remember that psychiatrists, I write it down here, are medical doctors, go to med school, and they're the only ones that can treat, well, not treat disorders, but they are the only ones that can prescribe medication for said disorder. Okay, all right. So let's go on to the next wording, which is psychological disorders. So you should know the difference between psychological disorders and what's an abnormal behavior. So psychological disorder is basically, it is a syndrome marked by a clinically significant disturbance in a person's cognition, emotion regulation, or behavior. Okay, and that is defined by the APA, which is also the American Psychiatric Association. So make sure to pause, rewind, get all that in there. Okay, now these behaviors, they're considered dysfunctional behaviors and they are maladaptive, which basically means that they interfere with the normal day-to-day life of that person, okay? And over time. So it's not just a week and then, you know, they're like, oh, you have this dysfunctional behaviors, so here you have a disorder. That's not how that works, okay? Um, so there also must be a distress that is accompanied by the dysfunctional behaviors. Okay, so that's all psychological disorders, what it's considered. Then you have abnormal behaviors or psychology. And this is basically dedicated to the study and treatment of psychological disorders or mental illnesses, right? And abnormal behaviors can be considered odd, eccentric, annoying, or even illegal, but it doesn't automatically translate into a mental illness. So it could have an abnormal behavior, but isn't considered a psychological disorder. Okay, now, in order for it to be criteria for a psychological disorder, it must have four things. Okay, and those four things are, first one is going to be maladaptive behavior. All right, which basically means that the behavior causes harm by making it difficult to fulfill the normal functions of everyday life. Okay, so it basically must be a behavior that doesn't allow them to function on a day to day. The next one is a personal distress, which basically means that the person's perception of his or own emotional distress, right? So they believe they're emotionally distressed, but it's all a perception, okay? Then the next one is atypical behavior, which is Write it down. Atypical behavior is behavior that deviates from what is considered socially or culturally normal. That would be considered atypical. And then the last one is a violation of cultural norms. And then this is again just basically anything, any type of behavior that deviates from what's culturally accepted. It's considered unacceptable or intolerable. Okay, so it's like extreme, would say a little bit more extreme. Okay, now we go on to some more legal terms when it comes to psychological disorders. And the first one is going to be insanity. So, insanity is a legal term, it is not a term that is used in any type of counseling or anything like that. Okay, and this just basically means that it is used to determine if the person is able to be held accountable or liable for their criminal behavior. Okay, and that's all that is. It's not a mental health or psychological term. There's no wording in that in APA. So this is just basically a legal term that is used. And it's basically to state that the person did not know what was right from wrong due to their mental state. Um, or it could be their inability to control their own actions. Okay. Um, Now, people, many times the court system will use this for people with mental illnesses that have committed a crime, and so they'll use insanity. Um, I will, I will say it's very rare for the person to be able to get away with it using this term. And then there's also the mental incompetence, which is also another legal term. And this is basically that the criminal is deemed mentally ill and unable to understand their criminal proceedings or aid in their defense, right? And then for this one, they tend to be placed in a mental health facility where they will get treated for the mental illness, okay? There's also some two words that you need to see. We'll see them often. And one of them is psychosis. Okay. And psychosis basically means that the mental disorder is so severe that the person loses touch with reality. Okay. And then we have comorbidity. And comorbidity is basically, and you see this a lot in the actual DSM-5, which I'll talk about now. And this is typically when there's a presence of two or more disorders at the same time. And then, of course, this is a controversy because sometimes some symptoms of one disorder overlaps with symptoms of another, and other disorders. So basically, one person could come out, this is what the contradiction is. Like one person could come out with like five different disorders because some of them overlap and because of this comorbidity. So in the DSM-5, they do have these statements and kind of connection to the other disorders, okay? And the next thing you need to know is the Diagnostic and Statistical Manual of Mental Disorders. This is called the DSM-5, and it's DSM-5 because they are in their fifth edition, basically. And this is basically a manual that is used as a source of criteria for defining psychological disorders. So psychologists, psychiatrists, people in the mental health field, mental health counselor, they're the ones that will read this DSM-5, and they're the ones that are going to look at the criteria, and then they determine if the person has or follows that or meets that criteria, and then they can diagnose them. And for this, the DSM-5, they consider environmental events, medical conditions, and genetic links as well for these behaviors. And in this, the DSM-5, there is ways of treating psychological disorders that focuses on the use of medication. okay, which sometimes that's the most common one, but obviously certain therapies are specific for, are good for some specific disorders. And then there's a lot of critics, obviously, of the DSM-5, and many of them say that there is a lot of the way that disorders are assessed or is very subjective. It is people's opinions on what they're seeing. So there's a lot of that controversy when it comes to diagnosing people. Okay, now in order for us to understand psychological disorders, we need to look at the different types of models and perspectives that are out there. Some of them you'll see are going to be from the approaches that we've learned of psychology. There's some new ones in there. And so just make sure to pause and write down this information. Okay, so understanding psychological disorders. So the first one we're going to look at is the medical model. And the medical model is kind of like this concept that it is the psychological disorder is a disease that has a physical cause that can be diagnosed and then treated and cured, often either through a hospital or it's treated with some type of medication. Okay, so that's really the medical model of how to treat somebody with a psychological disorder. Now, there's been recent discoveries lately that genetically is influenced abnormalities in brain structures. And then there's also biochemistry that contributes to many disorders. So they're doing a lot more of the science-based, right, research, and then that's kind of like what it's more of like that biological approach to a psychological disorder. But they definitely treat it as a physical, and they usually treat it in hospital or in with medicine. Okay, and they look at the genetics and chemistry of the person's body. Then you have the psychodynamic model. And psychodynamic model basically explain that mental disorders are based on Freudian belief that all our psychological problems come from our repressing past trauma, our memories, or our thoughts that are in the unconscious mind that avoid anxiety. So make sure to rewind that back. So you can write that all in there, okay? And then they also state that when anxiety producing thoughts try to break through the conscious awareness, that's what basically causes our mental distress or maladaptive behaviors. Okay, so that's the psychodynamic, right? Goes back with the psychodynamic approach that it's all in the unconscious. But this is basically saying that when those thoughts from our unconscious try to come forward to our consciousness, it creates a stress. To then it creates this maladaptive behaviors. Okay, then we go into the behavioral model, and behavioral model basically says, okay, that all behaviors, maladaptive or adaptive, are all learned from our environment, as well as operant conditioning, right, where it's reinforced or punished, also explains some of these disorders. Okay. Then we have cognitive model, and for them, these disorders are due to illogical, irrational, or maladaptive thought process. Okay, cognitive thought process, and they focus basically on the way that someone is thinking in order to understand their behavior. All right. So for this one, the perception, the person's perceptions, their attitudes, what they're focusing on, or their attention, as well as memories, can all affect the way that they are going to behave. Okay, and that's what they focus on as well to understand the person. Next one is going to be the humanistic model, And this one is that they believe that mental illnesses stem predominantly from issues from their low self-esteem, their poor self-concept, or feelings, um, well, poor self-concept and feelings, but also their maladaptive behaviors, due to their maladaptive behaviors. And this is also the result of their inability to be one's authentic self. So since haven't been able to be who they truly want to be, like their real self, then they manifest these maladaptive behaviors. Um, and they also state that each person has a natural drive towards growth of their authentic self. And then when these natural tendencies are blocked, they're going to experience stress, which then distorts their perception of reality. Okay, and that's the humanistic. Then we go to the biopsychosocial. Okay, and it's kind of like that combination of the three. And they believe that all behaviors, normal or like the adaptive or maladaptive, arise from the interaction of our nature, which is our genetics, and nurture, which is our experience. Okay. And so it's a combination of that nature and nurture. So some factors can be difficulties in a person's environment, their interpretation of events, and any type of bad habits or poor social skills, right, can contribute to this. And then also cultures. Cultures can differ in what is stress and what is, or different ways of coping with stress, such as, like eating disorders in the Western culture. So things like that. Okay. Now, there's this diathesis stress model. This is very, very important. It has nothing to do with the approaches. What kind of does, in the sense, it's kind of part of that biopsychosocial approach, but this model, you're going to see it often. And this is basically where they kind of combine the biological and environmental causes of psychological disorders. So in this model, they believe that both interact with each other, then cause the disorder. Okay, and so what they say, this model says, is that people are genetically predisposed to a disorder. Okay, and then when they're exposed to environmental stressors, that's what triggers the characteristics of the symptoms of the disorder, right? That they had genetically already been predisposed for. Okay. Now, diathesis, write that down, is the predisposition, right? Which is the biological based vulnerability to a particular illness, right? So it's basically genetically you're predisposed to this. Now, a stressor, right, which is the next one, is the environmental event that's going to trigger this biological based disorder. Okay. And then, and that's basically how this model kind of works. Okay, so it's kind of like using that nature and nurture together. Then you have the social cultural model, and this one focuses on societal and cultural influences in the person's environment. Okay, and there's kind of a few components of it that I need you to write down. And so you have what's called the cultural syndrome. And this is basically that similar symptoms and explanations of causes that occur in culturally specific contexts and are recognized within the culture. Okay. So cultural syndromes is that a specific culture is going to recognize similar symptoms and explanation of the causes. Okay. That culture will say, yes, this is this, disorder, and they agree with that. Now, there's also, one second. Okay, the next one is cultural idioms of distress. And this is basically where a culture will explain the distress or perceived causes of said symptoms, or like the causes of the symptoms, or why these disorders may happen, or a person's behavior, not necessarily di- giving them a disorder, okay, or diagnosing them, just kind of like that. This is what may cause this behavior. Okay, and then cultural relativism is basically that the disorder is only understood within the context of the culture. Okay, this could be some, like, due to some gender or age or some traditions, that it's only understood within the culture of that group. Okay, now, classifying disorders and, sorry, not classifying disorders, labeling psychological disorders. What are some benefits? What are some negatives with this? Okay, so some of the benefits of labeling and getting a diagnosis is basically treatment, right? You're getting the proper treatment for the disorder or the person is. It allows for people that are struggling with these disorders, help them understand their behaviors, as well as for families as well dealing with this, to help them better understand what this is and how they can get help. And then it allows for better treatment and managing of that said disorder. Okay, now, what are some negatives? And some of the negatives, obviously, is some of that labeling can be really very judgmental when it comes to certain people. Now, we've gotten better with understanding some disorders, but there's a lot of misconceptions of what these disorders really look like, and how people that are experiencing this and living with these disorders are, there's a lot of false information out there, a lot of misconceptions. Um, so one of the things, there was actually a study with David Rosenhan study, and you need to know his study. So please make sure to write this down. He did this study. He basically sent in 8 regular people with no psychosis, nothing. Okay. They were actually, most of them were professionals. Like, I think 6 of them were psychologists, doctors. There was a mix of 8 people, and they basically called in. This is in the 70s. They called in the hospital and a mental facility, and they basically said that they were hearing voices. Okay, and then they admitted them into the hospital, and some of them lasted for like 7 days to all the way to like 52 days. Even though they were like, okay, I don't feel anything anymore, I'm good. And all they basically told them is that they were hearing voices, and these people automatically, like, oh, you have schizophrenia, and here, we're going to treat you for that. So some of them stayed for about average like 19 days. All of the doctors didn't know that they were faking it, but yet, interesting enough, the patients that were there at the hospital kept on saying, like, these people are lying. These are not really true patients. So quite interesting. Definitely things have changed from the 70s, where obviously, hopefully that may not happen. But there's a lot of um, like critics on the DSM-5, or how people get diagnosed, because it's so subjective. A lot of the way that these things are diagnosed. All right. And that's pretty much it for this. And we're moving on to the next one and going in depth with the disorders. See you then.